right now, corporate America stands between you and your health care, and there's no argument about that.
I just had a situation recently where one of my patients fell and hit her head. And I was concerned because she was showing some abnormalities that she might have bleeding on the brain, something that's called a subdural hematoma. I had to call her insurance company to get approval for a CAT scan. And I was surprised when I had to actually spell subdural hematoma to the person on the other end of the phone that was making the decision of whether I could do that CAT scan. I got so frustrated, I hung up the phone, instructed the patient to go directly to the emergency room, where I'm sure the insurance company wound up paying 3 times as much to get that done. And unfortunately, that's what happens now.
Wow. That is just amazing.
The idiocy is unparalleled of the current system.
And I wish I could say it was a infrequent event that happens, but it happens every single day in my practice. I'm just a small solo family doctor.
Right. Well, I think people who have insurance and have had any type of serious need for care have experienced the denials of care and the runaround that they get from the insurance company.
And why are those denials? Why do they exist? Because it's all about cost and profit. It's not risk management, it's risk elimination for the insurance companies, but it's put on the back of the patients as well as the providers of health care.
And what more do you need when you're dealing with a serious medical illness? Do you need to fight with an insurance company over every nickel that's spent? And when I talk to patients that are ill, I work as their advocate. I try to buffer some of that, but they all tell you horror stories about the bills that pile up. And we have a spiral that occurs in this country where when somebody gets sick, they lose their ability to pay for health care, they lose their job. And that's why the #1 cause of personal bankruptcy is medical bills. And most of those people, 75%, had insurance when they got sick. So it's not always a lack of insurance that causes you to go bankrupt, but insurance companies don't want to pay for the care that you need. That's absolutely true. I keep hearing that the American people want choice, and they do. But what I think they want is a choice of doctor. They want to go to what doctor they want to go to. They want to go to what hospital they do. They don't care whether it's Aetna or Cigna or what insurance company, because all those companies do is restrict your choice.
Right, and that's part of the single payer thing. You still get to choose as a patient who's going to be your healthcare provider.
Single payer is basically an improved version of Medicare, Medicare 2.0, expanded to everybody. And the care is publicly financed by the taxpayer, because if you finance everybody, you're financing the people that are young and healthy as well as the elderly and sick. And so it's the broadest possible risk pool. And what that means is everybody's individual costs would be less. We already spend enough. With our taxes right now, 60% of our health care expenditures are covered. And that's more than other countries spend on health care. And so to have a nationally financed program, but to remember that it's personally and privately delivered by doctors like me, and hospitals that are private. They're not government-run enterprises. I don't want to be a government employee. I want to take care of my patients, and I feel that this is the best way and really the only way to do that.
Mind if I put them in the meter? Absolutely. The issues with Medicare needs improvement from the standpoint of the levels of reimbursement that doctors are provided. A lot of doctors are in a poor position because they're disproportionately over-concentrated in Medicare and Medicaid patients. But notwithstanding, you also have to understand that the insurance companies, some doctors won't take certain insurance like a consult. If I'm going to call in a consult to say some doctor in a specialty, and he asks me, well, what kind of insurance does the patient have? And you tell him the insurance, and all of a sudden we're sitting there, well, why don't you refer it to this guy? That happens not at all infrequently. And that's the problem. So when you talk about standing, the argument being that the government's going to be standing between you and your health care.